Hello, my name is Carmen Gonzalez, and my presentation will be on India's HIV and AIDS alliance. So, to start off, the public health problem, why does HIV and AIDS exist? Well, HIV and AIDS exist globally, but in this presentation, we'll focus on why it's prevalent in India. And it is prevalent in India because marginalized groups, which is defined as people who are outcasts or considered sexual outcasts in this case, they're so vulnerable to this disease, especially because they risk the chance of being targeted for violence, being criminalized, being verbally abused and discriminated because they're sexual outcasts. And so that just makes them afraid to seek help. And so that is why it's prevalent in India. And HIV is transmitted through the exchange of infected body fluids, and those include semen, blood, rectal fluids, vaginal fluids, breast milk, cum, and pre-cum. And these fluids must come into contact with a mucous membrane or damaged tissue or be directly injected to the bloodstream. Where and how did HIV originate? Well, genetic analysis believe that it came from a chimpanzee in West Africa that had the chimpanzee version of the immunodeficiency virus. And once that virus was transmitted into humans, when humans were hunting for chimpanzees and were exposed to their blood, that virus transmitted to humans and mutated to HIV. Risks of the community in the future. If one has HIV and does not treat their infection as soon as possible, they can run the risk of developing AIDS. And to be more specific, HIV refers to the virus itself, and AIDS refers to the late stage of HIV infection when the immune system is damaged. HIV can progress in a few years unless one takes ART, which stands for antiretroviral therapy. And it is not a cure, but it is a way to control the virus for one to live a longer and healthier life, and for one to reduce the risk of transmitting the disease. And here I've just provided a slide of how you can get HIV and how HIV is not transmitted by. Although it is known that HIV is transmitted through bodily fluids, that does not include saliva. HIV is more so transmitted through rectal and vaginal fluids. How to solve the public health problem. So as I was doing research through India's HIV and AIDS Alliance website, I found two of their past projects that I thought were very simple yet unique and effective ways to prevent the transmission of HIV, and those include Avahan and the Action Project. So Avahan is actually funded through the Bill and Melinda Gates Foundation, and they've donated a total of $338 million to the cause. Their goals are really to improve HIV prevention, condom promotion, STI management, and behavior change communication. They began in 2003, and they train social workers towards peer education. They help patients find STI treatment, they distribute condoms, and they fund social media platforms to reduce the stigma of HIV treatment. Two examples of how the HIV transmission problem was solved from other cultures and countries or from history involve HIV awareness seen in North Carolina and notable HIV actions seen in San Francisco. The Alliance of AIDS Services, which stands for AASC, serves people living with HIV and AIDS and their loved ones through compassionate and non-judgmental care. They spread awareness, education, and advocacy and hold different services, fundraisers, and events such as the AIDS Walk, Dining Out for Life, Red Ribbon Ride, and May Day Bingo Getaway. In San Francisco, the HIV spread was a frightening time, and so doctors, researchers, and students at the University of California, San Francisco sought to make a change about it. And so, in collaboration with the staff at the San Francisco General Hospital, they responded by opening up the very first dedicated HIV clinic in the country called Ward 86 in January 1, 1983. Public health in the future. If one already does have the HIV virus in their system, there is a combination of medicines available to fight off the infection, and it is called ART, which stands for antiretroviral therapy. Like I had mentioned in my previous slide, unfortunately it is not a cure, but it can control the HIV virus from spreading and attacking the immune system. In my opinion, I think we should revoke the stigma of those that have HIV transmission because we never know their background, and for the most part, especially in third world countries, HIV is very prevalent because they don't have sources readily available to them, such as not only as condoms, but like healthcare in general. The transmission of the disease is more likely to happen in places that do not have resources that developed countries do. And so we should have an open space of conversation to help spread the awareness of HIV prevention and HIV treatment. I also think it's very important to get tested, especially if you're sexually active and you're not aware that you're transmitting the virus, let's say. You can transfer that disease to your partner, and your partner can transmit it to other people as well. I think another way to help put a stop to this virus from spreading is to definitely donate to research. HIV is a virus that is not treatable, and so it'll be very helpful to donate to researchers who can gather tools and knowledge to put an end to the virus. And lastly, here's a page of my references, which include citations for my pictures used in this presentation as well. Thank you for watching my presentation, and hope you learned a little more about HIV and AIDS and the prevention towards it.